Hey everyone, I'm Susan Feniger, and I'm one of the Scleroderma Research Foundation's founding board members. That before we begin our intermission, I just want to share a bit about a dear friend who I miss very much, Bob Saget. Bob and I met through my close friend from college, Sharon Monsky. She was the founder of the Scleroderma Research Foundation. When she first invited Bob to perform at Cool Comedies, in 1992, I had no idea that he would become the incredible scleroderma advocate we all knew and loved. Bob and I hosted that event for more than 30 years. And when I learned of his passing in January, I was just devastated. I miss him so much, and I wish that he was here with us today because I know how much he cared about every single person with scleroderma and those that love them. We've dedicated this forum to him, and so I'd like to share just a little bit from a conversation Bob and I had at Cool Comedy Hot Cuisine this past November, just a very few months before he passed away. Thank you so much.
I can't tell you how meaningful it is to me personally to hear Dr. Wigley talk about the improvements in treatments and survival rates, because I lost my sister Gay to scleroderma in 1994. And back then, doctors didn't know much about what scleroderma is or how to say it or what it does. A lot of people do have trouble saying scleroderma.
Yeah,
But
it's true.
Can't change the name.
No, but I think, our mission way back then was like, we need to get this out there so people become aware of what this disease is and how horrific it is.
And it was I lost my sister in 1994. In 1991 was when she got something. They didn't know what it was. Was a great teacher. That was my grandmother down there. She's now alive. She's 140. But my sister Gay was this teacher that people say was a remarkable person. They tell me now to this day. And she didn't know what she had. And doctors misdiagnosed her continuously. They said that she had lupus, that she had mental issues, that they came up with every disease. And it turned out they didn't know what scleroderma was. And then they treated her with prednisones and cortisones, and it was treating symptoms, not what we're able to do now through research. And she was at our benefit one year with Sharon, when Sharon was alive, and then the next year she was not with us anymore. And that's why I'm never stopping doing this. We're here to cure people, and all of our money goes right to research, and we've raised over $45 million.
When Sharon Monsky decided to start, when she was diagnosed with scleroderma, she started the Scleroderma Research Foundation. She asked me if I'd be on the board. It was, yeah, absolutely.
So it's going to be the best 5-course meal you can have. It's going to be the best wines you can have. It's going to be the best talent you can have.
We're really committed to basically making it happen for our patients. We want to find therapies that make their lives better. We want to find therapies that extend their lives, and we want to get to a cure.
We have the best team of researchers that we've ever had. In the coming years, the next 2 to 3 years, I'm really, really excited to see what they can bring us.
This is a terrible disease and it needs to find a cure.
It's a rough time in the world right now, and we are focusing tonight on curing people.
The first signs that I had scleroderma, even though I didn't know it was scleroderma, the first times that I noticed that something was wrong was a lot of my hair started coming out, which I didn't quite understand. And my hands, anything that I touched that was cold, I felt this burning sensation. And even in the summertime, my fingers always felt cold. I didn't quite understand that. So I started out talking to my general practitioner about what it was, was this any particular kind of issue that I should be upset about? And I got all kinds of things that they came up with, hormonal, nerves, but I clearly knew that that wasn't it. During that time, I got into doing triathlons. So I raced. I did biking, swimming, and running. So I was very in tune to my body and when it was working well and when it was not. And, it's interesting. I was working to try to do a half Ironman, right? And I decided to do the Honolulu Marathon. And in training for that, I trained really hard. And I knew that my timing should be getting better, but by the time I got to the race, I could tell that my lungs weren't quite what they were like even some months before, and then I felt like there was something really wrong. And it was at that point that I decided to really reach out to some other types of doctors. I went to the Cleveland Clinic, some other places, but finally at the Mayo Clinic, I was diagnosed with scleroderma.
Hi, it's me, Bob, and I wanted to talk to you about the annual Cool Comedy Hot Cuisine event benefiting the Scleroderma Research Foundation. Last year, because of COVID, we reimagined the event as a virtual experience, and the live broadcast aired on YouTube and was such a huge success, we are doing it virtually again this year. This year, my co-host and Top Chef Master Susan Feniger and I will be hosting the Cool Comedy Hot Cuisine event on Sunday, October 17th at 8 p.m. Eastern, 5 p.m. Pacific. Only this year, the broadcast will be even better than before with a whole new lineup of world-class performers, plus maybe some live in-studio surprises. All funds raised through Cool Comedy Hot Cuisine go directly to support the SRF's research programs aimed at finding a cure for scleroderma. So don't miss out. Sponsor registration is open now for the October 17th event. Go to srfcure.org to register today. That's srfcure.org. Register as an event sponsor now and help us end this disease together. Thank you.
I'm extremely excited for what we're going to see in the future of treatment for scleroderma. When I started working on this disease, there were no FDA-approved treatments for scleroderma. We are now in a place where we have 2 FDA-approved treatments for scleroderma and a number of other treatments which are being used to help improve the lives of patients with the disease. I think we're entering now an era of new drugs which may be approved for scleroderma, and those will come not from a single place or a single company or a single lab. It's going to come from our ability to do clinical trials in scleroderma in a way that takes into account patient heterogeneity, the individual, and how one patient responds versus another patient responds. So for example, drugs that many years ago may not have been approved because their clinical trial failed may now make it through the clinical trial because we understand patient heterogeneity. We can now see a subset of patients that will improve, and I think that will result in more and more drugs that get approved for scleroderma. So I think we're going to see a really exciting time for the disease in terms of treatment and being able to better help these patients.